Health Partnership and the health center organizations that comprise our consortium of 39 clinic sites throughout Santa Clara and San Mateo County. The clinics represented here today include ACI, Asian Americans for Community Involvement, Gardner Health Services, Indian Health Center of Santa Clara Valley, Northeast Medical Services, Peninsula Healthcare Connection, Planned Parenthood Marmonte, Rotocare Bay Area, Ravenswood Family Health Network, and School Health Clinics of Santa Clara County. We're holding today's press conference to urge the community to continue to seek health care at our community health centers despite fear based on the recent elections. Our speakers will address the community in English, Spanish, Vietnamese, and Mandarin. Our speakers include community clinic leaders, clinicians, and community health workers whose missions are to provide affordable and high-quality health care for all. Our first speaker is Dolores Alvarado, CEO of Community Health Partnership, who will deliver her remarks in English and Spanish.
Good morning, everyone. Let me do a voice check. Is that okay? Reasonable? Up? All right. Good morning, everyone, specifically members of the press. Thank you so much for taking the time to be here. This is important. And thank you to all our guests, our community health centers who are here today. My name is Dolores. I'm the CEO of Community Health Partnership. I'm also an immigrant from Mexico. This is a topic that we're going to discuss today that's near and dear to my heart. In addition to serving as the representative of community health centers in San Mateo and Santa Clara County, we are also an advocacy agency for healthcare rights in general. We also provide health education and information about breast and cervical cancer prevention in the counties of Monterrey, Santa Cruz, and San Benito. So our reach is far and wide. The recent elections have reignited fear in many of our communities. Achieving the American dream has vanished for many of us. In 2017, under similar situations, community health centers experienced a significant drop in patient visits, which meant that many were deferring health for their safety. And I can tell you, I remember very well the next day after a government action in Washington, we could see the parking lots of our clinics empty the next day. So we don't want that to happen again. Today, we have invited you, the press, and many of our colleagues, friends, supporters, patients, etc., and others to help us share the word regarding the importance of continuing your health care by keeping your appointments. We know that we are in the midst of a transition at the government level, and we are all, I think everybody here is experiencing levels of uncertainty and concern. We know that. Our request for counseling services has risen at every site. Nonetheless, we are here to inform you that our community health centers are open and will continue to maintain normal hours, providing medical, counseling, and other services. Please know that when you are inside a community health center or another medical building receiving medical attention or other service, you have the right to be protected from any kind of outside intrusion, no matter what your immigration status is. Before you leave, please go to the table we have here on the side. We have yellow cards which talk about your rights. We have a phone number attached there that tells you where you should call if you see certain activity that may be painful or harmful to you or your family, or if you have someone knocking at your door stating to be a government agent. So please take a look at all the information we have out at the table. Again, your rights, immigration, we have information about immigration assistance, so lawyers that are ready to assist you. And we also have a directory of all our community health centers, all 39 sites. We also have another clinic here today, which I'd like to highlight. That's Bay Area Community Health Center. Thank you very much for joining us. And thank you for your attention, members of the press. This is really important. If you could help us, please help us get the word out You can refer them to a phone number here, patients and community, to learn more about other services. They can call 579-6028, 579-6028, area code 408. We're also working with our city council members, and many other folks are too, like Sacred Heart, to ensure that some policies are put in place that will clearly ensure your security. But for now, let me repeat, if you are in a community health center, if you go in to get your services, you are protected. And we will be doing training for the front desk of the clinics. But at this point, we cannot guarantee any other kind of protection. So however, we want you there. We want you to see your doctor. We want you to get your COVID vaccine, etc. So with your permission, I'm going to switch over to Spanish. Buenos días a todos, miembros de la prensa. Muchas gracias por estar con nosotros esta tarde. Mi nombre es Dolores Alvarado, directora ejecutiva de Community Health Partnership, y también soy inmigrante de México. Community Health Partnerships es una asociación de centros de salud comunitarios en los condados de Santa Clara y San Mateo, con 39 clínicas. Además de eso, brindamos educación e información sobre la prevención del cáncer de mama y de cuello uterino a los condados de Monterrey, Santa Cruz y San Benito. Las recientes elecciones han reavivido el miedo en muchas de nuestras comunidades. Lograr el sueño norteamericano, ¿no? Yo estoy aquí porque mis padres me trajeron a lograr el sueño norteamericano. Se ha desvanecido para muchos de nosotros. En 2017, los centros de salud comunitarios tuvieron una caída significativa en las visitas de pacientes, lo que significó que muchas personas posponían la atención médica por miedo y por la seguridad por su familia. Hoy los hemos invitado a la prensa y a amigos, pacientes, etcétera, para que nos ayuden a compartir la palabra sobre la importancia de continuar con su atención médica y cumplir con sus citas. Sabemos que estamos en medio de una transición en el gobierno y niveles de incertidumbre y preocupación. Sin embargo, estamos aquí para informarle que nuestros centros de salud están abiertos ahora y continuarán manteniendo el horario normal, brindando servicios médicos a ustedes, a nuestra gente. Tenga en cuenta de cuando se encuentre dentro de un centro de salud comunitario o otro edificio médico recibiendo atención médica o otro servicio, usted tiene el derecho de ser protegido de intrusiones externas, sin importar cuál sea su estatus migratorio. Y en español lo vuelvo a repetir, que tenemos muchos servicios e información en la mesa aquí detrás de mí para la protección de nuestras familias, especialmente nosotros los inmigrantes. Visite nuestra mesa de recursos para obtener información sobre sus derechos, asistencia migratoria, servicios de consejería, salud mental y un directorio de nuestros centros de salud comunitarios con domicilio, qué servicios se dan, etc. Y también qué lenguaje, porque tenemos las clínicas hablan varios lenguajes. Gracias por su atención y por hacer llegar el mensaje a sus espectadores. Si necesita información adicional, llámenos al 408-579-6028. Muchísimas gracias.
Our next speaker is Sarita Coley, Chief Executive Officer of ACI, Asian Americans for Community Involvement.
Thank you, Kathy. Good afternoon. As Kathy mentioned, my name is Sarita Kohli, and I'm the CEO of ACI, also known as Asian Americans for Community Involvement. For the last 50 years, ACI has been here in the community in Santa Clara County, providing healthcare, behavioral health, and other services, including now dental as well. And our services are geared towards cultural communities, We are a community health center, and we are here for the community and for your health. And I'm here today to say that AKI was set up in 1973 to address the needs of the Southeast Asian refugees that were being resettled in Santa Clara County. So we have had a long history of serving immigrant and refugee populations, particularly those that are impacted by trauma and have need for to address their chronic medical conditions, and otherwise face cultural barriers or other barriers, economic barriers to care. So we are here, our doors are open, and we welcome you to continue to receive your healthcare services as you have in the past. I want to say that we serve people with cultural humility and sensitivity, and we serve people regardless of immigration status and regardless of ability to pay. It is not our job to ask about anybody's immigration status. We are here to take care of your health, and we really urge you to continue to keep getting those services from us. As Dolores had mentioned before, inside our clinics, it is a safe space, and our staff will be trained to address any concerns that you might have, and you will be protected within the four walls of our clinics here. And I speak also as on behalf of my sister clinics, which Kathy had listed out here. All of us are here to serve the community, and we really urge you to please continue to access services. And do remember one thing, if you take away from this, I want to say this: we are community health centers, and our staff are from the very communities that we serve. Our staff are sensitive to and understand the issues that you, the community, are facing. And so we are here to take care of you, our community. We are here to take care of your health, your mental health, your dental services, and any other support that you might need in terms of social services as well. So please continue to get your services, and know that we are here for you. Thank you.
Honored Nurse and Director of Clinical Services for Indian Health Center of Santa Clara Valley.
Good afternoon. Thank you, Kathy. As she mentioned, my name is Andrea Contreras. I am a registered nurse and the Director of Clinical Services at the Indian Health Center of Santa Clara Valley. We are a federally qualified health center and community clinic dedicated to serving immigrant communities, Medi-Cal eligible, underinsured, or uninsured persons needing healthcare, behavioral health, and dental services. Today, I'm speaking on behalf of all Community Health Partnership members, not just the Indian Health Center, when I say that we are here to serve your healthcare needs. We understand the fear and uncertainty many are experiencing after the recent election. You want to protect your families, and we want to protect them too. Please know that the law says our health centers are protected spaces, and immigration enforcement cannot enter our clinics. Your personal and medical information are private and legally protected. We will never share your information without your permission. Your health and the health of your family should never come at a political cost. We believe that healthcare is a fundamental human right that we are committed to protecting, especially for children, seniors, pregnant women, the medically vulnerable, and those with disabilities. We encourage you to prioritize your health, which includes being seen for routine checkups, management of your chronic conditions like high blood pressure and diabetes, bringing your children in for their well child visits, prenatal care, and vaccinations, especially as we enter the respiratory virus season. Flu and COVID rates will increase in the coming months, and getting vaccinated is the best way to protect your family and yourself. It is also important to get routine preventative cancer care screenings, such as mammograms, colon and cervical cancer testing. If you do not have health coverage, please don't let fear stop you from applying.
there are programs in the county that provide low or no cost health coverage. Our clinics will never ask for your immigration status when you apply for coverage or seek care. We understand the concerns you may have, but please know that our clinics are safe spaces where you and your family can receive the care you need. Your health and well-being are always our priority. Thank you.
Thank you so much. Our next speaker is Barbara Estrada. She is a community health worker with School Health Clinics of Santa Clara County, and she'll present her remarks in Spanish.
Hi, good afternoon. My name is Barbara Estrada. Soy emigrante y trabajadora comunitaria de salud en School Health Clinics de Santa Clara. Estamos reunidos esta tarde para enviar un mensaje claro a la comunidad y a los pacientes de sus centros de salud comunitarios que están abiertos y están para servirles independientemente de los resultados de las elecciones pasadas. Los centros de salud comunitarios y su personal son parte vital de nuestra comunidad en el condado de Santa Clara. Estamos aquí para apoyar sus necesidades de salud durante momentos difíciles. Los centros de salud comunitarios son un lugar seguro al que pueden acudir a recibir atención médica independientemente de sus ingresos o estado migratorio. El interior de nuestras clínicas es un espacio protegido donde la ley de migración no se ejerce de acuerdo a la política del Departamento de Seguridad Nacional. Enfatizamos que no debe de perder o posponer su atención médica por temor a alguna acción migratoria o a la deportación. Debe hacerse sus chequeos médicos de rutina. Debe venir si tiene una condición crónica, como por ejemplo presión arterial alta o diabetes. Debe traer a sus niños para las visitas de control, las visitas relacionadas con el embarazo, las vacunas que son absolutamente necesarias, especialmente en esta temporada cuando aumenta la tasa de gripe y COVID-19. Las pruebas de rutina de detección de cáncer, incluidas las de cuello uterino y las mamografías que pueden salvar vidas. Descuidar su atención médica puede ser peligroso para las personas mayores y todas aquellas que son médicamente vulnerables o discapacitadas. Además de brindar atención médica, el compromiso de nuestros centros de salud comunitarios siempre ha sido el crear espacios seguros para el empoderamiento y la pertenencia a la comunidad, Queremos servirle y ser un recurso para usted y ayudarnos a obtener información sobre asistencia legal, servicios sociales, lo que es carga pública y otras inquietudes que tengan sobre el acceso a la atención médica. Su salud es prioridad para usted y para nosotros. Por favor, tenga en cuenta que nuestros centros de salud están aquí para usted. Si necesita más información, por favor llame a Community Health Partnership al 408-579-6028 o visite su sitio web www.chpsccc.org para encontrar una clínica cerca de usted. Muchas gracias.
Our next speaker is Tao Trin. She is a program coordinator with Community Health Partnership, and she will deliver her remarks in Vietnamese.
Good afternoon, my name is Thao Trinh. Xin chào, tôi là Thảo Trinh, là điều phối viên của Community Health Partnership. Chúng ta tập trung ở đây sáng nay vì chúng tôi muốn gửi một thông điệp đến cộng đồng cũng như các bệnh nhân rằng các trung tâm y tế cộng đồng của chúng tôi luôn mở cửa phục vụ quý vị và gia đình quý vị bất kể cuộc bầu cử gần đây. Các trung tâm y tế cộng đồng và đội ngũ nhân viên của họ là một phần thiết yếu trong cộng đồng và khu phố của chúng ta trên khắp quận hạt Santa Clara. Chúng tôi ở đây để đáp ứng nhu cầu chăm sóc sức khỏe của quý vị và hỗ trợ quý vị trong thời điểm khó khăn này. Các trung tâm y tế cộng đồng là nơi an toàn để quý vị có thể đến chăm sóc sức khỏe, bất kể thu nhập hay tình trạng nhập cư. Bên trong các phòng khám của chúng tôi là một không gian được bảo vệ, nơi mà không được phép thực thi luật di trú từ chính sách của Bộ An ninh Nội địa. Chúng tôi thôi thúc quý vị không nên bỏ lỡ hoặc là trì hoãn việc chăm sóc sức khỏe quan trọng vì sợ bị trục xuất hoặc hành động về nhập cư. Quý vị cần phải kiểm tra sức khỏe định kỳ. Quý vị cần đến khám nếu bị mắc bệnh mãn tính như huyết áp cao hoặc tiểu đường, khám sức khỏe trẻ em, khám thai và tiêm vaccine là việc thực sự cần thiết, đặc biệt là trong những tháng tới khi mà tỷ lệ cúm và Covid tăng cao. Khám tầm soát ung thư bao gồm chụp nhũ ảnh sàng lọc và xét nghiệm ung thư cổ tử cung cũng có khả năng cứu sống chúng ta. Đối với trẻ em, người cao tuổi, người dễ bị tổn thương về y tế hoặc người khuyết tật, việc trì hoãn hoặc từ bỏ việc chăm sóc sức khỏe có thể gây nguy hiểm. Ngoài việc cung cấp dịch vụ y tế chăm sóc sức khỏe, cam kết của các trung tâm y tế cộng đồng của chúng tôi luôn tạo ra không gian an toàn để trao quyền và sự gắn kết cho cộng đồng. Chúng tôi cũng muốn đóng vai trò là nguồn lực cho cộng đồng để giúp họ có được thông tin và nguồn lực quan trọng về hỗ trợ pháp lý, những dịch vụ xã hội và các mối quan tâm khác về việc tiếp cận dịch vụ chăm sóc sức khỏe. Chúng tôi muốn quý vị đặt sức khỏe của mình lên hàng đầu. Hãy nhớ rằng các trung tâm y tế của chúng tôi sẽ luôn ở đây và ở đây vì quý vị. Để biết thêm thông tin, hãy gọi Community Health Partnership theo số 408 579 6028 hoặc truy cập trang mạng www.chpscc.org để tìm một phòng khám gần nhất nơi quý vị. Xin cảm ơn. Thank you.
Our next speaker comes from Northeast Medical Services. We have Lily Tan, registered nurse, who will make her remarks in Mandarin.
Good afternoon. My name is Lily Tan. 大家好，我的名字是 Lily Tan，我是东北医疗中心的护士。我们今天聚集在这里，向社区和患者传递一个明确的信息：无论最近的选举结果如何，您的社区健康中心始终开放，为您和您的家人提供服务。社区健康中心及其工作人员是桑塔克拉拉县社区和邻里的重要组成部分。在这个困难时期，我们将为您的健康需求提供支持和帮助。社区健康中心是一个安全的地方，无论您的收入或移民身份如何，您都可以来这里接受医疗服务。根据国土安全部政策，我们的诊所内是一个受保护的空间，不允许移民执法活动。我们敦促您不要因为害怕移民行动或被驱逐而错过或推迟重要的医疗服务。您需要进行常规的健康检查。如果您患有高血压或糖尿病等慢性疾病，请一定要来就诊。儿童健康检查、孕期相关检查和疫苗接种是绝对必要的。 尤其是在即将到来的流感和新冠疫情增加的月份，常规癌症筛查，包括乳腺癌、子宫颈癌检测，可能拯救生命。对于儿童、老年人、医疗脆弱人群或残疾人士，延误或放弃医疗服务可能会非常危险。除了提供医疗服务，我们的社区健康中心始终致力于为社区创造安全的空间，促进社区赋予的权利和归属感。我们还希望成为社区的资源中心，帮助他们获取重要信息和资源，包括法律援助、社会服务、公共负担问题及其他与医疗服务相关的疑虑。我们希望您将健康放在首位。请记住，我们的健康中心始终在这里为您提供服务。谢谢。Thank you.
Our last speaker is Stephanie Kleinheims, CEO of School Health Clinics of Santa Clara County.
Good afternoon. My name is Stephanie Kleinheims. I'm the CEO of School Health Clinics of Santa Clara County. We're a community health center with clinics throughout the county, predominantly based within school sites where we serve children and their families. At School Health Clinics, we're concerned that the recent federal elections may cause our school families and community patients to be afraid to receive health care. Back in 2017, we experienced significant decrease in patients making and keeping appointments for fear of law enforcement or immigration officials targeting them. People's health suffered, and we don't want that to happen again. Under the first Trump administration, even U.S. citizen and green card status families were fearful and confused about whether seeking health care could get them or their relatives in trouble. As a result, children and their families missed out on important vaccinations, checkups, preventative services, and necessary visits. Kids missed school and parents missed work, which could lead to a loss of income. I'm also a nurse practitioner. Many of our families live in high poverty neighborhoods within San Jose and Gilroy, where School Health Clinics operates. I can only imagine what our patients might be feeling: fear, distress. Will they be victims of discrimination? Will their families be separated? And these are significant contributors to toxic stress, which can have a direct impact on our patients' health. We've seen that children who don't receive proper health care can experience adverse effects in cognitive, social, emotional, and physical health. We've seen an increased prevalence in depression, anxiety, and even heart disease later on in life. Children whose families face economic hardship when they're young or who experience deep and prolonged poverty are at the greatest risk of dropping out of school, having poor health outcomes, unstable work histories, and among other adverse consequences. We're here to urge the community not to be afraid to get care. As previous speakers have mentioned, our health clinics are safe and welcoming. Our clinics and waiting rooms are protected sites. We will not provide your health information to anyone without your permission. And we want to help you protect your health and your family so that the future can be better for everyone. Now is not the time to forego healthcare or ignore your health needs. Continue to make and keep your doctor's appointments for you and your family. Please apply for health coverage if you don't have it. Do not jeopardize your health at this crucial time when your strength is needed to take care of your family. If we become too afraid to care for our health and become sick or unable to work, then those who want to harm us win. Don't let that happen. Thank you to all of our speakers who are here today to send a strong message to our community to continue seeking healthcare. We at School Health Clinics and our other community health centers are here for you and your family. Thank you so much for being here today.